what's a technology or an area that you really like or that maybe people aren't as aware of or talking about that you think is going to be really important?
I think it's more of a use case than a specific technology, but I think anything that allows patients or plan members, like if you're on the health plan side, it's the same sort of thing. Anything that lets them effectively self-serve. I'm very excited about that. We talked about sort of the patient intake kind of thing before. That is a kind of self-service, sort of queuing myself up into the workflow of the practice or the hospital. I also think, and this is sort of like the third rail of physician engagement, but I think self scheduling, certainly when we have asked consumers, even when we have asked our own colleagues, what's your biggest hangup about patient experience? It is either I don't know how much I'm going to pay before I go to the clinician, or I cannot self schedule. Everything else now allows you to self schedule. That is not a problem. And we still cannot do that in healthcare for reasons, and I get it. But we've reached a point where I don't think we have the luxury of resisting anything that is an effective self service. And I would include things like asynchronous telehealth here.
Yeah.
I think we have reached a point where the pressures on the workforce and the need for productivity from our clinical and supportive staff is so high that the industry really needs to get its hands around these technologies and work on making them better instead of trying to keep them at arm's length.
See, that's where I think this AI or even just a dynamic questionnaire, quite frankly, would be the key. In primary care, it's generally more accepted, but then you get into some of these subspecialties where demand and access is a real issue. They want to make sure that it's a legitimate reason for them to be seeing them. And so I get that, but I think we can overcome it. But there's definitely a cultural fear from the provider side on it.
I think that's also interesting when we think about sort of the cultural and the mindset that exists within healthcare. We're going to reach a point where there is a generation of physicians who are in practice, and they may already be in med school or be in residency, who never went to school without Google. When we get to that point, an EMR that is not functionally searchable is no longer acceptable.
Yeah.
I think that those are the kinds of shifts that are coming that may already be here.